Welcome to Melanin Table Talks, a podcast of Healthy Beginnings. Healthy Beginnings is a program of BRIC, a pre-cradle to career nonprofit focused on moving children and families towards upward economic mobility. Through our Southward Promise Neighborhood initiative here in Newark, we are able to holistically support families from pregnancy onward with the help of over 30 different partners. Melanin Table Talks is a regular conversation with individuals from various backgrounds with the goal of furthering birth equity and reproductive justice. Before we dive into today's conversation, we encourage you to like, share, and subscribe so you can stay up to date on the latest conversations. Now join us at the Melanin Table. So welcome to today's Melanin Table Talk. We are here in honor of Black Maternal Health Week 2025. Black Maternal Health Week was founded by Black Mamas Matter Alliance to ensure that we're centering Black women as we continue to ensure that we have healthier outcomes in pregnancy, childbirth, and the postpartum period. This year's theme is Healing Legacies, Strengthening Black Maternal Health Through Collective Action and Advocacy. So that's why we have a beautiful lineup of Black strong women today from across the legislative and in the trenches work to really share with you our own unique experiences around Black Maternal Health Week. So I'm your host, Jasmine Rivera. If you've ever seen this podcast before, you've seen Joanna and I here. Joanna Juju Montgomery, who is our Assistant Director of Healthy Beginnings, and she's a doula extraordinaire. If she lists her credentials, we'll be here for 25 minutes, so we don't have time for that. We have our amazing Congresswoman McIver, who is such a staunch supporter of maternal health locally, but also at the federal level as well. And we have our Newark First Lady, Linda Baraka, here to share her experience and be amazing with us today. So, and stay tuned till the end because it's Black Maternal Health Week. There are a ton of other amazing things that are happening in the city and beyond this week and through the rest of the month that we'd love to share with you. So now let's get started. I just want to start by opening up to all of us. We're having a conversation at our Melanin Table Talk around what motivates each one of us to do this critical work.
Well, I'll start. My motivation is Black moms and babies deserve better. All the time, everywhere I go, it's the same conversation, my same statement. Mm-hmm. We deserve better no matter where we live, no matter what our social class is, no matter how much money we make, we deserve better. And we should have the care and the level of care that any other mom has in this world, especially our white counterparts. And to be in 2025 still having this conversation is just honestly disgusting to me. And so that is what drives me to continue to do what I do because we deserve better, and I'm not going to stop until we get that.
Yeah, for sure.
Amen.
And I think for me, if it was any other group that had these type of rates that Black women have, it would be an endemic pandemic. Everybody would be screaming about it from the top of their lungs. And so as Black women, we have to make sure that we highlight it and empower people to advocate for themselves.
Yep, absolutely.
And with me being in the trenches, working with our Black and brown moms and seeing the struggles that they go through, trying to give birth, just wanting to see the joy on the other side of it, that's what continued to motivate me. Yeah. To know that I'm a part of making sure that if no other system is willing to do what they need to do for them, that I'm there to advocate for them.
Absolutely. And for me, this critical work is important, one, because I think we all share this. We are Black birthing people. We have been through these types of experiences or not, right? But we are hyper aware of we don't have a lot of control, like if we can get pregnant, how that looks, if we're going to be safe. I mean, we all can tell stories forever around anyone that we know who's a Black person becoming pregnant and being really scared. And I'm not sure that other folks feel that way, even though America as a developed country has horrible rates for everybody, but we're just not talking about it in that way. So I care about myself and my babies, of course, and I care about all of the other Black women who do not have the level of resources that I have had to be able to have other kinds of births that kept me safer than other people.
Yeah.
Yeah, and we don't all have that option or opportunity. And even if you do, I mean, and I would love for us to talk for a moment about what are your thoughts on news coverage around this just being an issue that impacts every kind of Black woman across socioeconomic status. Oftentimes, I'm in public health, right? When we talk about some things, people reduce it to, it's poverty, you don't have health insurance, you didn't go to the doctor. What are your thoughts and feelings on that? Like, this impacts us.
I think all of the studies have proven that that's not true, right? And so a few years ago when Serena Williams had her baby, she kind of shed light on the fact that it doesn't matter how much money you have, how much education you have. This is something that's systemic about Black women, regardless of your socioeconomic education status. And so I really appreciated her shedding light on her story and allowing other people to really take notice that, like, it's not just poor people in the ghettos that this is happening to.
Yeah. And it circles back to kind of what we talked about when we were hosted our event the other day. Was it yesterday?
Monday.
Oh, sorry, I don't know what day of the week it is anymore. where we saw sometimes it's just based around racism. Really, literally all the time.
Right.
And I think we need to acknowledge that. And I think people have to be more forthcoming to say that out their mouths, no matter what women look like. You know, you see a lot of white women who are championing this issue too. They've been talking about it. They want to do things to make it right. But I think the number one thing you have to do is call out what it is, and it's racism. And the First Lady brings up a great point. You can be rich with money and still go into that birthing room and have a different outcome, you know, than a white woman who is wealthy. And so, or a white woman that might not be that wealthy. So at the end of the day, we have to call it out for what it is.
Yeah, no, I'm glad that you brought that up too, because on Monday when you said, I was like, yes, that's my congresswoman. Because people don't say it. They don't say that, oh, they're dying. There's reasons why they're dying. But let's talk about it, right? Let's actually say the word racism. We have to. And the implicit bias that medical professionals have towards Black women.
What drives me so much about this conversation is that I wish so much more that healthcare providers were sitting in these spaces as well.
Yes.
Because we echo them, you hear it on the news, but how many of them are really impacted by what? I don't know if it's the fact that they're in this work, they've been in this work for a while. We have brought forth the fact that maybe training should take place, but what happens? Who's the watchdog even if they are doing training? And now I'm going to put it out there, DEI and the talk of cutting all of those initiatives. Who's to say training will ever take place?
Exactly.
Or if they do, again, will it be brought to the forefront?
No, absolutely. On Monday, we hosted a Black Maternal Health Week event in the city of Newark, Congresswoman, myself, and Councilwoman Roundtree. And we had some doctors participate from the local hospitals, Beth Israel and University Hospital, who were supposed to come. And even getting them their systems, right, like the hospital systems, to agree to allow them to come, they had to go through legal because of what you're talking about, DEI. Whereas in the past, it would have been like, oh, of course we want to participate. And so that is really scary for us at this time.
Yeah, and I'm glad that you bring up this idea of systems getting in the way too, because we know with this work, with racism in general, but with Black maternal health specifically, there are individual actors, but then there are systems that are not supportive of even people who want to do something different, right? Like if as a doctor you only have 10 minutes to spend with your pregnant person, how are you going to dig in deeply to all of the things that are going on, right? Like I've been in the OB where they hand you that piece of paper that says like, don't eat this, do eat that. And that's the whole, there's not conversation. And then you have your list of questions. If you forget one, you have to wait 3 weeks until you go back. So it's so insidious and deeply rooted in the way that the systems are created. The payer systems don't make sense. And it doesn't help when a doctor or a nurse wants to do the right thing and be an amazing person, spend more time, they lose money. I think we've all seen those movies, the documentaries where the one, oh my goodness, Joanna, is it Birthing Justice or the other? I think it's Birthing Justice, where that midwife was talking about, or the OB, she had to close her practice because she spent so much extra time with each one of her people that she was losing money. And people didn't have insurance. So she's like, of course I'm going to support you, even though I have insurance, but they couldn't pay. So she can't keep herself alive and feed herself. So she had to close down.
But this is why bringing forth doulas into these spaces, because we fill that gap. You know, information that cannot be provided by the doctor that they're seeing at the time because they have to be rushed off, then we're able to still fill that gap. They're able to come to us and ask us for information.
Absolutely.
Ask us different questions that they're not understanding. Now, that does not mean that I'm stating that we are sitting here and we're being professional medical individuals. However, we are right. We are support. We're trained.
And in Birth and Justice documentary, one of the moms talked about how she felt more comfortable talking to her doula or the midwife versus her doctor, because like you said, there's not enough time to actually dig in those appointments to make it worth the doctor's time, right, for the parents to get more comfortable.
And that's why it's important to support doula programs like from, your program, your organization, what BRIC is doing, because we need more doulas. We need to support training. We need more funding for such. And we have to do that because women deserve a one-on-one person that they can just literally text if they want to and say, look, hey, I was thinking about having this Caesar salad today. Is Caesar dressing okay for me? So at the end of the day, we definitely need that for sure.
So, and I mean, Joanna is on everybody's speed dial. She's like, wait, I got to take a call. She had to walk out of her launch last year because she had to go support her mom in the hospital. So a doula is a flexible, amazing, supportive, just extra component and critical resource to people, especially in the systems that we're in. Yeah. So let's talk a little bit about legislation and paying doulas, right? Because Joanna, I can talk about this all day, right? Medicaid reimbursement. We are so happy that we are able to reimburse Medicaid for doulas. Now, this is a recent thing. We know there are not that many folks on the registry, and there are a number of folks who are able to do the work, but they aren't actually doing it because it is not financially feasible. Because you make about $1,200, right, Joanna, for 8 visits, which includes the birth. So I'd love to hear from each of our perspectives. You as a legislator who's fighting for these things at the federal level, you as very proximity to legislation, being an advocate locally, and Joanna, you as being an advocate for people every day. How do we really move and make this doula work more of a workforce development strategy that allows our doulas to actually sustain their lives and not just be abused and overworked and burn out and not be able to stay in the work?
Yeah, absolutely. I think it's definitely more advocacy. I like what Lisa Asari and First Lady Tammy Murphy are doing with Nurture NJ, right? They're taking that perspective as a workforce, as opposed to like it being maternal health, more as a workforce thing, giving people an option. Correct. This is a career opportunity. Midwifery is a career opportunity. And so I think that's really important. And then to educate people, right? Like our moms, our grandmoms, they have been doing this for decades, for centuries. And why not get paid for it?
Amen.
Yeah. And we actually talked about this a little bit. Even when I was the council president, we were meeting with, I forgot what group it was at the time, to talk about bringing another training program for doulas to create more doulas in our communities. And so we need more of that. We need to be, on the federal level, even from like being a part of the Black Maternal Caucus, we talk about how we're sponsoring legislation that would get more money to organizations out here to be able to host these programs to promote. I mean, we're finally there with the Medicaid. I mean, we have more work to do around that. All the conversation around Medicaid and the cuts, that's a whole nother conversation that I would take this podcast into 4 hours in talking about. But I think also, too, we have to be able to support to get more doulas. Like, there's not many on the registry, like you said. And it's like, how do we promote in our communities people to want to become doulas, get them in the program, but also pay for the program, pay them to be in the program, right? The whole idea of the money you make is not enough compared to an OBGYN. I'm not saying people are professional, they're taking over a doctor's space, but at the end of the day, your work is important too. And we have to move like that. As the First Lady mentioned, I'm very happy that New Jersey, we're leading the way, compared to many states. Grateful for First Lady Tammy Murphy and all that they're doing. But we have to do more. And some of that work has to trickle down from the federal level. And now in the state of our country and what we're going through right now, people just don't have any type of interest in that. They say they do, but how are you showing it? Like, show me that you believe in that. And they just don't. And so we're really in a critical time where our work that we worked so hard for all of these years to get to this point where we're at is kind of taking a step back with this administration right now.
And as someone who is on that registry, I have taken a look. There's so many people who have dropped off. And it's because it's not sustainable. The sad part is that California and Washington State, they are leading. I mean, you're talking about a doula being paid through Medicaid $3,000 for birth and prenatal and postpartum visits. Why can't New Jersey do the same? And I'm grateful to all the efforts that Lisa Asari as well as First Lady Tammy Murphy is doing. But we already have models out there that we can actually, we don't have to create the wheel. We can actually take a look at what they're doing. How did they make it happen? Because we want the same, and we're one of the country's richest states.
Yeah, and I think another thing to factor in is a lot of different pieces about that. Is one, California is a very large state, right? So those things factor in depending on what their budget looks like. I mean, hopefully they can continue the work that they're doing on their doula program, because many states now are having a conversation of, if Medicaid takes a cut, how do we pick up the cost? And New Jersey's factoring that in too. We don't want to see people without health care, period. So many folks are having those conversations, but I just think it's a different level state to state, how they're able to do it versus what we've been able to do so far, even though we know we have to do better. Yeah, that's why I said it's the federal level too. The federal plays a big piece of this.
Yes.
We've acknowledged what is happening. We know what's happening, regardless if people don't want to say it off their tongue. And we have to do the work to make it better. And so I put it in my ownership of me being in Congress and people who are there, you know, all women. I mean, the whole Democratic Women Caucus, it's like we can't keep talking about Black maternal health and we're not doing anything. It's just like out in the sky. Oh, yeah, it's this week. Woo hoo hoo. And no, that's not enough. Like, we need for you to fight with your white counterparts. Everybody has to get into this, white men, everyone, if you really want to make a difference, and put some money to the programs out there.
Absolutely.
There are infrastructures out there. You do it every day. How do we support that? You know?
Yeah, no, and I totally agree with you, you know, in regards to the capacity between both states.
Yeah.
My thing is that this fight has been going on for a while now.
Absolutely.
Okay, so we're not just talking about this year. We're talking about
years.
This program has been in existence for a few years.
Yeah.
Okay, and it's always been the same conversation that's being had.
Yeah.
And what's going to happen is doulas are not going to join Medicaid.
Yeah.
They're going to continue to try to be private, but if they can't afford a private doula, we're talking about our communities.
Absolutely.
Yeah.
I'm not talking about anybody else's community. I'm talking about our communities.
Yeah.
Okay, everybody cannot afford, and you know, from our organization alone, it's free.
Absolutely. 100% free.
Right.
Not billing Medicaid at all.
Yeah. I have not billed Medicaid at all for moms. We've been doing this for free.
Yeah.
But still being a Medicaid provider, it's not sustainable.
Yeah.
You would have to do, according to that, for you to live in the state of New Jersey, and I'm just talking about Newark, the city of Newark alone. Okay, you would have to do 4 or 5 births a month.
Which is a lot.
That's a lot.
It's a lot.
I have done 4 births in a month, and me doing those 4 births has caused me to be burnt out from time to time.
Absolutely.
Yeah.
Okay, because babies come when they choose to. You know, so I can't say, oh, the beginning of the month, the first week of the month, this is when this baby is coming.
Yeah.
Second week, it doesn't happen that way. I had an example where I was in a hospital. I had gotten home. I slept 2 hours and had to go right back to the hospital.
Yeah.
Okay, but because I'm dedicated to our moms, I'm not going to let the burnout get
the
to me.
demand is
But guess
high.
what?
Yeah.
You do
It's
get
high.
tired.
It's high. And also, like, if you are a Medicaid doula, right, like, you're not working for an organization with a salary who you can be more flexible in hours or whatever, right? Like, you have those 8 visits that you're billing for. Like, Joanna meets with people whenever they need. Like, there's calls daily sometimes, especially for the teen population. Like, it's a high touch strategy. It is a lot of support. And you can't bill for that because you only get those 8 visits to bill for. So it is really, it's a problem. And as we talk about different kinds of the workforce that are parts of the solution, I sometimes feel like we are putting this all on doulas and underpaying them when there are also different levers that we can pull in order to do this work. So I'm really interested it's been so quick, I'm going to start to wrap up soon. I'm really interested from you all, your thoughts on starting to have this conversation about midwifery and billing and making it more accessible and affordable to have a midwife in New Jersey and raising awareness around that, right? Like, I was privileged. I live in New York. I love New York. I live in New York. I had a home birth with a midwife. Every single one of my appointments, 45 minutes, just her fully talking to me. She came to my house. Like, I'm on the phone with her. Like, we had a high touch connection. You don't get that and you don't get paid well sometimes either. Like, she got paid, but you don't always get paid well. So I'm curious, as we start to close out, what your thoughts are on other policy levers and other workforce levers that can be supportive of this work as well.
Yeah. Well, first of all, I won't hold it against you that you live in New York.
Don't. I'm from New Jersey, though.
That's number one. That's important here right now in this conversation.
I'm in New Jersey.
Brick, I'm gonna talk to y'all later about that. But I think it goes back to a lot of things that need to happen, right? I think right now we are behind the 8 ball of what we should be doing on a national level. I'm not just talking about New Jersey or what people are doing at the state level, but on a national level, we should be creating policy that allows for the same kind of health care you're getting from private practice, from Medicaid, whatever you have, you should be able to get doula support. And I don't think we're there. We're not there at the level of how much they get paid. We're not there with every insurance company just willingly supporting doulas as a part of your insurance. And that's a problem. And that's something that nationally we have to work on. But also, too, because we're behind the 8 ball, and as Joanna said, we've been talking about this for decades. The federal level should be putting dollars to advance us. We can't start at a space where it's like, okay, change the policies with insurance and that's it. That ain't enough. Like, we have to go back, pour more money into the pot, get more doulas, pay them a living wage, because that's not happening right now, and do the work. But at the same time, there's not enough people, and it's hard to believe this, but it's not enough people who are, as the First Lady mentioned, who are well versed on what Black maternal health means.
Absolutely.
They're not. Black women.
Yeah.
Absolutely.
Black women. I talk to a lot of young women, and they're looking like, oh, that's still a problem. I'm
That's
like,
not my problem.
Yeah.
where have you been? Like, okay, well, I had a successful birth. I birthed 4 kids. Like, no.
Yeah.
Even my own mama, who had 4 babies, she's like, oh, Black maternal health. Talk to me about that. I'm like, yeah, Mom,
Mine
let's talk.
too. My
Let's
mom
talk about it. Like, Mom, let me tell you about some of the things that are happening. So I just think it's bringing awareness. We have so much more work to do to inform people. I think when even women are going to the doctor, it's like, how can we ensure that every OBGYN or midwife is saying, you know what, do you want to look into a doula?
Absolutely.
Are they saying that? Is that a regular process? No. And it goes back to the point of needing training. Where are we at with giving healthcare professionals training or mandating them to have training about how do they undo the racism? Because that's really what it's about.
Yeah.
Many doctors, especially white doctors, have been trained for so long to operate the same way. It's the same baseline check, despite what your previous health is, despite what your living circumstance. They don't look at any of that. They're just like, oh, check, okay, good, see you later. And that is how we end up with women dying, because people are not taking the effort to really dig into their health, dig into their situation. Black women are stressed half of the time. What we're dealing with, taking care of households and everything that we're doing, and how many healthcare professionals are really looking at that? Yeah. We're not. And so we have to have the Undoing Racism workshop in the healthcare professional world. And until we get there, we're going to continue to see women dying from pregnancy-related deaths, because we're not dealing with the root of the problem. And that is where we need to be, along with everything else that we need to be doing.
Yeah. And defining what racism means, right? It does not mean that I look at you and
I don't like you. Yeah,
right? Like,
no.
it doesn't mean that. It means the systems, the structures, the way we were socialized and trained, and all of that is much deeper.
I can't believe you live in New York when we have this mayor in this city.
I'm a New Jerseyan, but I'm there.
Girl, you gotta come on over. You gotta come on over.
Bring me.
I'm really happy that here in the city of Newark, we have a mayor who's supportive of community-based solutions, right? What BRIC is doing is a community-based solution to this issue. Midwifery as a way of working, right? Like a Department of Labor issue is something that we should look more into, and the state is actually looking more into it now. The same way they're doing with the doulas, right? They're expanding the program that way. And then just like as community organizations, empowering them to do this work, right? Like not having it as something that's over there in Trenton, bringing it right to where the people are. And I think that's something that BRIC is doing, which is why I'm so glad to support the program.
Thank you. You know, I'm on the trajectory for midwifery. That is my ultimate goal. I hope with it.
I'm just kidding.
Yeah, and again, I think like our people have been doing it for so long.
Yeah, and
so long.
And that's how I sit. And going back to Black Mamas Matter, you know, the whole being of having Black Maternal Health Week. This is, I'm coming off the backs of our ancestors.
Right.
You know, I shared with Jasmine not too long ago that my grandmother birthed her grandchildren. Now, she wasn't considered a midwife.
Wow.
You know, but we know how to do this.
But she was, though.
Right, exactly.
She didn't have the title, but she was.
Right, but she did not consider herself. That's something that she just knew how to do. You know, so when I got into this birthing space, I reached out to the ancestors first. You know, I went to them for advice because this is something as Black women, brown women, culturally, this is what we do.
Yeah.
Amen.
This is what we do. We center ourselves. So as I continue to strive to move towards midwifery, and looking in different programs. The hardest thing right now is actually finding programs where you can take courses and do traditional midwifery. Now, I can go to any college to become a nurse and become a certified nurse midwife. However, there's the certified practitioner midwifery, and a certified midwife. All right? New Jersey supports that. However, there's so many obstacles to take that route.
Yeah.
I actually have to go to another state to do that, where we can do it right here. And I know that the talk is being had. And I just, I'm looking I have someone, Jill Wadnick, who I love dearly, who is in a meeting as we speak, in regards to the midwifery model. But yeah, my hopes that in a few short years that we're able to see more midwives and to be able to have our families do as you did, Jasmine, give birth at home, and not a mom saying, I'm going to do a free birth and chance it at giving birth at home.
Yeah.
Okay, because now you're putting yourself in danger. And I'm not saying that you can't do it successfully, but do it with someone who's actually able to assist you do it.
Yeah.
So we have come to the end of our time so quickly. I just want to spend 1 second just giving our last takeaways to all the people in the live audience today and all the people viewing and the Black birthing people who are here celebrating Black Maternal Health Week right now. So each of us, one quick takeaway or one thing you want to leave folks with.
I think for me, it's definitely that having this conversation should make you aware, right? You shouldn't be scared of the statistics, but it should make you aware of what's happening with Black women in this country, right here in this state, and empower you to act on your own behalf, empower people around you to act on your behalf, whether it's your partner, your parent, your doula, whoever, making people aware of what the statistics are, right? Because in New Jersey, the New Jersey rate is higher, 7 times for a Black woman to die versus the national average, which is 3.
Yes.
Right? Our babies are 3 times more likely to die in the first year. And so making yourself aware of those type of numbers, right? Knowing that people really actually die, and empowering yourself to take that information to your doctor, to your doula, to your partner, right? Like when you're doing your birthing plan, letting them know, like, this is real. It's not over there.
Yeah.
On our panel the other day, Gabrielle was on there. She talked about her own experience with it, right? And you can actually see people who have gone through this and not being afraid, right? I don't want you to be afraid to say, oh, no, I'm not going to ever have a baby. No. Use this information to empower yourself to say, I'm going to do what's right for myself, for my body, and trust myself, right?
Trust yourself.
Trust that my doula is there to support me. The midwife is there to support me. If my doctor is not listening to me, I have these supports around me to help advocate on my behalf, even when I'm incapacitated.
Yes.
Because that's possible.
Yes,
Absolutely.
That was my case.
Yes.
My last statement is, I want all women of color to experience joy.
Yeah.
That is so important to me, to know that you're loved and cared for. And I wish everyone would get the word out about there are doulas out here. There are doulas who can help no matter what your income is. Yeah. Because it doesn't make a difference what your zip code is that you're able to get certain services, or what your economic status look like, or what your title is. That shouldn't make a difference. Okay? I want, especially Newark moms, they walk into hospitals and they think that everything is good. And I'm piggybacking off of the story that you gave about a mom who said that she had a pretty good birth. Who's to say she's not already traumatized and doesn't know what a good birth looks like?
Yeah.
And I've seen that on so many occasions where they have been spoken to in the most negative way, but they accept it because that's what they're so used to.
Yeah.
Absolutely.
And so again, I want from this point on for moms to understand you can have a joyful birth.
Absolutely.
And I'm here to help you do it. And there's so many of my doula sisters out here who are in the trenches, on the grind, willing to help you as well.
Yeah. Beautiful.
Yeah. For me, it is the point that it is all of our jobs, no matter if you are elected, if you are a mom, a teacher, a healthcare professional, to make sure that we are bringing awareness to the matter. Women can do anything. I am a firm believer. We are the changers. We are the doers. We are the difference makers, no matter who's in charge. It is upon us and it is on us all the time. And I think in this time in 2025, there's no reason why we should not be getting everything we need and want. No matter what we look like.
Absolutely.
And I think the more we spend time elevating this issue, making everybody aware, making them talk about it, making them tweet about it, Instagram about it, everything under the sun, then we will pressure people who are in charge to make the differences to do so. And that's the bottom line to it. I think right now it's still like a little shadow where folks are not really elevating this conversation. And that is what we need to do. Our power is still with our voices. And we have to use our voice to speak up and bring power to the matter so that we can make the changes that we need to make to really see the difference. And I just don't see even the different panels from place to place, 18 cities I represent here in New Jersey. There's just not enough conversation about it for me. Like, I'm not comfortable with that. And so, you know, a lot of times people look to the leaders just to like make the changes and amplify the matter. It doesn't work like that. Like, it's our job to do that. It's our job to speak out and bring attention to the matter. And so I, you know, encourage anyone who is listening, those who are joining us today in the audience, to use their platforms. You text out to your friends and family, your cousins, everybody that you know, and tell them about Black maternal health and the issues that we're combating. You don't have to have a PhD in it. Just give them the basics and ask for them to elevate too, because it's a real issue and we can't make change until folks in leadership know that we're not playing and we want to see changes.
Absolutely. And my final takeaway before I close this out here is Joanna and I are so aligned. So similar to what Joanna was saying, right? It's like these are our practices that we are reclaiming. This often becomes a thing that is for like crunchy middle class white women, right? Like birthing at home, even having a doula, which you can have in any birth setting. They feel like they are not ours. Even when we talk about lactation in the breastfeeding world, we were wet nursing babies that were not ours. There's a lot of trauma and misconceptions and mistrust tied up in this space, and it distracts and inhibits us from being able to have the best health outcomes and have the most joyful births, lactation, and parenting that we could have. And we need to raise awareness around these things and legislate them as well. But bringing the awareness with the legislation is critically important so that our folks can have every option that they want for themselves and for their family. So that is what we give to you all.
I just want to let Joanna know in advance. I'm going to call you just in case you make me want to go out there and have a baby.
Yes.
Look, I'll be there. Joanna's going to be my doula.
I'll be there. And she'll do it too. So just our final closing. Thank you all. I'll say I've closed multiple times now. Thank you all so much for joining this conversation. Our Congresswoman for fitting this into your busy schedule. Our First Lady as well for fitting this in. Joanna, who got surprised this morning when I told her, hey, I knew you would say no, so I wanted to wait until 1 hour before to tell you to join this. So thank everyone for being out here today. I want to bring awareness. It is day 6, it's the 16th today, of Black Maternal Health Week. There is one more day tomorrow. Tonight, we are having a paint and chew that is for our moms and families. We just come out, we paint, we have a good meal. We do that every single year now. We're going on 3 years of doing that. It's always really fun. Also, I'm going to bring attention to a Courage and Care doula exhibit that kicks off on April 29th. It's really to bring awareness to the critical work that doulas are doing in this community. And I also want to let you all know that to the point of doula training, we are launching our second cohort of doulas that we are training in May. So stay tuned for all of that, and you can link to all of this in our show notes. Does that sound official? That's what podcast.
That does. That does.
And thank you all so much for joining our Melanin Table Talk.
Thank you. Thank you.
Thanks for joining us at the Melanin Table. To learn more about Healthy Beginnings or BRIC's other programs, visit bricnetworks.org. See you next time.